Hello everyone, I'm Anudeep. Today my case study is on quality measure of USCF Medical Center. Our project guide is Dr. Farooq Alami. UCSF or University of California, San Francisco Medical Center is located in California. Its facility number is 50454 and the rating on Google is 3.6. The Yelp is 3 and the overall rating on the Care Dash is 4.8. The doctor's rating for UCSF is 3.9. The data of this case study is collected from the Center for Medicare and Medicaid Services. The data is archived and must be extracted before use. The time frame used in this dataset is from 2015 to 2022. The measures used in this case study are from HCA-HPS, that is Hospital Consumer Assessment of Healthcare Providers and System. The measures used are HCOM-6YP, HCOM-7A, H-recommended PY, HCOM-5AP, and H-symptoms-YP. So why only these measures? These measurements are related to patients' understanding, clarity, and satisfaction on their treatment. This can give us a good estimate when comparing with different hospitals. Example, do patients have information about their recovery at home? Did they understand the care? Did they understand their medication? Did they get the symptoms after their discharge? And if they are satisfied with all the above questions, then would they recommend the hospital? In this case study, I also compared UCSF Medical Center with the three peer competitors, that is Kaiser Foundation Hospital, South San Francisco, Mayo Clinic Hospital, Rochester, and Brookdale Hospital Medical Center. The simplest strategy to choose these competitors is to look at the common equivalent service provided by hospitals. For example, UCSF and its competitors offer similar services and are mostly focused on organ transplantation. So my next question is, why these hospitals? The questions I ask for myself are, how different areas affect the quality of the healthcare, and how similar are their services, and does the level of treatment vary from patient to patient when they change the hospitals? And my last question is, how are their ratings on Yelp, Oler when compared to UCSF and the other competitors? The biggest challenges faced in this case study are consolidating data and understanding technical terms in the health data, and difficulties in understanding similar measurements like H recommend PY and H recommend DY. The only difference is they would definitely recommend, whereas the other one is probably they would recommend. The following slides are my control charts and my analysis. In all 5 control charts, the red lines represent the lower control limit and the upper control limit of all the competitor hospitals compared with UCSF Medical Center. In my first control chart, which explains about the patients who reported yes, that they were satisfied about the information they received during their recovery at home. In comparison to other hospitals, most patients agree that information is provided to them prior to the discharge. However, in 2020, there is a decline causing patients unhappiness. In my second control chart, which is based on patients who agreed that they understood their care when they left the hospital at home, when compared to other hospitals, UCSF data showed a steady decline over time till 2021, but increased from 2021 to 2022. The third control chart is based on patients who reported yes, that they would recommend this hospital. When compared to other hospitals, UCSF data showed a steady straight line, which indicates that patients are happy about their services they got. The fourth control chart is based on patients who reported that staff always explains about their medicines before given to them. There is a steady decline from 2015 to 2019, but we can see that in 2020 there is a rise in understanding the drug knowledge, but again there is a decline from 2021 to 2022. The study reveals medication from after 2020 was making patients unhappiness. Maybe due to COVID reasons, patients were cared additionally at the time of 2019 to 2020. In my fifth control chart, uh, is based on patients who reported yes, that they did receive written information about possible symptoms to look after discharge. UCSF medical center stays between the lower and the upper control limit in contrast to other hospitals, showing that it is under control and declining after 2020, but it is not significant. The quality measure at UCSF stays between lower control limit and the upper control limit. This means that the criteria are under control and the patients are satisfied with all of the UCSF services in order to preserve quality. From 2020 to 2021, all measurements except HCOM 7A shows a steady decline till 2020, but increases from 2021 and 2022, which could be a major attribute that was affected by the pandemic COVID-19. I believe that there is also room for improvement, such as ensuring that patients understand discharge instructions, encourage patients to ask inquiries, and communicate by creating a safe environment for them to do so. Thank you.